Hey folks, welcome to Discussions with Dr. G. Dr. G here, and welcome to the kickoff episode of Evidence-Based Practice in Community Health. So let's start right at the beginning. What do we actually mean by evidence-based practice in community health? I know it sounds like one of those academic buzzwords that gives people flashbacks to grad school, but honestly, it just means, well, maybe just is an understatement. It means bringing together the best scientific evidence, your own hard-won clinical expertise, and then tossing in what actually matters to your community or population. It's like a recipe, kind of, a very nerdy recipe. Okay, now I always hear folks use evidence-based practice and research utilization like they're the same thing, but I mean, they're really not. Research utilization is like when you find one study and you go, that's cool, let's use it. But evidence-based practice is broader. It's a whole system. You're not just picking your favorite research cherry. You're really looking at patterns, considering all the data, integrating it with what you know, and reflecting on what matters to your patients or your community. It's a bit like not just picking out one puzzle piece and calling it the whole picture. Honestly, I had to learn this the hard way. There was a time during my bedside nursing life where there's one wound care protocol that, no lie, dated back to the Paleolithic era. Okay, not really, but it was seriously outdated. I went down a rabbit hole of new research and realized, we're doing this all wrong. So I made a presentation, and because nurses love a theme, or maybe it's just me, I illustrated every step with these little cartoons of my cat, who's like the most reluctant little research assistant ever. But guess what? The staff bought in because it wasn't just research for research's sake. It was about safer care based on the latest science and what worked for our specific population. That is what evidence-based practice looks like when you actually bring it to life in your community. Now that we've got down the what, let's talk about the how. Evidence-based practice isn't just some mystical black box. It follows a process. You've probably heard these steps before, and if you haven't, buckle up because I'm throwing acronyms at you. Ask, collect, analyze, integrate, implement, evaluate, disseminate. It all starts with asking a focused question, and we use the PICO format. Patient or population, intervention, comparison, outcome, and time. Basically, it's a fancy way of avoiding vague, hand-wavy questions. Let's say you're working at a public health clinic and you want to boost vaccination rates because, no surprise, vaccination hesitancy is still very real. You whip up a PICO question, search for evidence, and now here comes the good stuff. You don't just Google and grab the first blog post you find. You look for the highest level of evidence out there, right? There's this hierarchy, and yeah, the Melnick and Fineout-Overholt pyramid is kind of the standard. At the very top, you've got your systematic reviews and randomized control trials. That is your gold. So let me give you another real-world example. Our own local health department didn't just wing it with a new outreach plan for vaccines. They used systematic reviews from the Cochrane collaboration. Think of them as the big league fact checkers and CDC guidelines to shape their approach. They collected the right data, analyzed it, and rolled out community events based directly on proven strategies. And then they kept measuring how it was going and shared what they learned. That's the cycle. Ask good questions, use great tools, pick the best evidence, and tweak as you go. And you know what? The process isn't as intimidating as it sounds. I mean, okay, learning to frame those PICO questions took me longer than I'd like to admit, but once you get a feel for it, it becomes second nature in your nursing practice. Just don't ask me to recite the whole pyramid from memory. I always mix up which level goes where. Let's just say aim for levels 1 and 2 when you can. So, Where do you find all this fancy evidence anyway? Well, first you've got the heavy hitters like the CDC and the NIH. These places are basically treasure troves for guidelines, data, and recommendations. If you're in Minnesota, or honestly anywhere, the Minnesota Department of Health Intervention Wheel is another great framework. It gives you practical interventions for just about every public health concern. And don't ignore things like Healthy People 2030, which actually sets goals and measurable objectives, or nonprofit resources like the Cochrane Collaboration. Again, those systematic reviews are gold. Of course, nothing's ever as simple as just look it up. If only, right? There are real challenges, knowledge gaps. Hey, who really learned how to use medical databases on their first week on the job? Limited time, heavy workloads. Maybe your clinic doesn't have the latest tech or librarians to help. Or sometimes there's just not a lot of organizational support. Sometimes, even when the evidence staring you in the face is rock solid, implementation just doesn't happen. But nurses, honestly, are stubbornly resourceful. I remember this one new grad, we'll call her Mia. Total superstar, but terrified of research at first. She was seeing a spike in diabetes in her community and wanted to do something about it, but kept saying, Dr. G, this research stuff is overwhelming. I gave her my go-to. Start small, use trusted online databases, and lean on your mentors. Most of us secretly love nerding out with new evidence. Next thing I knew, she was presenting action plans at staff meetings like a pro. No cartoon cats required, but I like to think she at least doodled a few. The bottom line here, community health nursing thrives on evidence, but also on persistence, teamwork, and not being afraid to dig for answers. If nothing else, I hope today showed you that evidence-based practice isn't just doable, it's essential, and honestly, maybe even a little bit fun when you let your personality shine through. Stick with me for the next episode where we will unravel how epidemiology fits into all of this and why it matters for real-world practice. Until next time.